Okay, the next exam is the Neer's impingement of the shoulder. The shoulder is passively flexed forward. The patient may experience pain at full forward flexion of the anterior or the superior aspect of the shoulder. The patient is then asked to flex at the elbow and the extremity is brought further into midline. This is a positive Neer's impingement test if the patient experiences pain in the shoulder. The Hawkins test for impingement. The shoulder is abducted to 90 degrees, flexed at the elbow at 90 degrees, and it is a midline motion with rotation toward the midline done in this fashion. The patient will complain of pain in the shoulder if it is positive for impingement. Some patients with a rotator cuff injury will also have discomfort with this motion. So that is the Hawkins sign. Supraspinatus or Job's test is to check for supraspinatus pathology of the shoulder. Patients to bring their arms out, abduct to 90. Then you bring them in approximately 20 degrees and have them point their thumbs downward. And you check bilaterally, explain to the patient that they must resist your downward force. This can be done at the same time or individually. Any pain that is elicited in the shoulder is positive for supraspinatus tendinitis or pathology of the supraspinatus tendon. The drop arm test, the patient is passively abducted until they complain of pain. At the point that they complain of pain, the passive motion is stopped. The patient is then asked to gradually lower their arm to their side. A positive test would be an arm that would come down part way and then fall to the side, eliciting a positive drop arm test, which is consistent with a large rotator cuff injury. The subscapularis test, the patient is asked to internally rotate at the shoulder, put their hand on their lumbar spine, and then as the examiner, you bring their hand off their lumbar spine. At this point, you release the hand. If they can maintain the position of the hand that without any motion, it is a negative test. If the patient's hand is vibrating or it seems unstable, at that point you can put pressure on their hand. If they resist, it is a negative test. If they cannot resist and you can compress their hand to their lumbar spine, then it is a positive test. A positive test indicates pathology of the subscapularis tendon. The sulcus sign is checked for multidirectional instability of the shoulder, and more specifically, inferior instability of the shoulder. You grab the patient's arm just proximal to the elbow and steady the shoulder with your non-examining hand. You put gentle downward traction. A positive sulcus sign will show an area in the lateral proximal shoulder that will be demonstrated by a sulcus sign, which would be a small divot in the skin. This happens when the humeral head is distracted from the glenoid. This is difficult to demonstrate positive on a patient who is negative. This is a negative test. Downward force, negative sulcus sign. Here, turn around, let's do the other side, just in case it's positive on one side. And again, it is negative bilaterally on this patient. The apprehension test is done with the patient lying on their back. This is to test for anterior shoulder instability or anterior shoulder laxity. The patient is held at 90 degrees at the elbow and 90 degrees at the shoulder, and they are rotated in a downward fashion. This test is done watching the patient's face for their apprehension look, and that happens to patients who feel that they are about to dislocate. They will get a look on their face of impending doom. At that point, if the patient has a facial expression consistent with apprehension, then you know that this is a positive test. If that is positive, the relocation test, by putting the palm of your hand in the proximal humerus, you will gently put pressure on the humeral head and that should take their discomfort away. That is a positive relocation test. This exam is again for impingement, primarily at the AC joint. This is the cross-arm test. The shoulder is brought parallel to the ground across the patient's body. If it is positive, the patient will complain of pain at this point. If they complain of discomfort but no distinct pain at the AC joint, then at this point you have them extend at the elbow and it may make the test positive. Again, this test is done for AC joint impingement. A Speeds test, patient brings their arms up to 90 degrees of flexion, palms up. This is checked bilaterally. They resist your downward force. This is positive for bicipital tendonitis. Relax this arm. Should the patient have bicipital tendonitis, they will complain of pain in the proximal shoulder, the distal shoulder and the proximal humerus in this region right here. Okay. The next test is O'Brien's test, which checks for a labral tear in the shoulder. Patient is brought up to 90 degrees, and then at this point they are asked to rotate their thumbs downward and move their shoulders approximately 15 degrees toward the midline. This should be done by the examiner. It is checked bilaterally. At this point, the patient will resist downward force. If there is pain in the shoulder, it's consistent with a labral tear. The hand is then rotated palm up in the same 15 degrees of orientation, and pressure is again applied downward. If there is less pain or no pain with the palm up, it is a positive test for a labral tear. The patient needs to complain of pain with downward pressure in the shoulder for this to be a positive O'Brien's test.